You know, we often talk about major organs like the heart or brain, the ones that are constantly in the spotlight. But there's an unsung hero, quietly working behind the scenes, doing incredible work to keep us balanced. Often we don't even think about it until something goes awry. I'm talking about the pancreas. Today, we're taking a deep dive into the fascinating yet complex world of diabetes. We've got a rich stack of sources from intricate diagrams of the pancreas to comprehensive research on diagnosis and complications, all designed to give you a truly clear and insightful understanding. Our mission: to unpack this vital information, demystifying the science, separating common myths from surprising facts, and equipping you with a truly well-informed perspective on what diabetes really is, how it profoundly affects the body, and what it means for daily life.
That's right. Think of this deep dive as peeling back the layers to reveal the incredibly intricate biological dance happening within us. We'll explore how that dance can sometimes lose its rhythm, leading to diabetes, and crucially, what that means for how we live and manage our health.
Okay, so let's zoom in on that unsung hero you mentioned, the pancreas. When most of us think of it, we might just picture digestion. But it's so much more than just a digestive organ, isn't it?
Absolutely. The pancreas truly has a remarkable dual role. On one hand, it has an exocrine function, meaning it secretes powerful digestive enzymes, things like amylase, trypsin, and lipase, directly into the small intestine to help break down the food we eat. That's its digestive superpower, you could say. But then there's its equally vital endocrine function, which is what we're largely focusing on today. This involves secreting hormones directly into the bloodstream. And here's where it gets truly fascinating. Within the pancreas, there are specialized clusters of cells, often called the islets of Langerhans. For our purposes, we really need to focus on two key players here: the alpha cells, which secrete a hormone called glucagon, and the beta cells, which are the crucial producers of insulin. There are others, like delta and F cells, but insulin and glucagon are the main regulators we're discussing with diabetes.
Okay, insulin and glucagon. So it's like a finely tuned internal thermostat for our blood sugar, constantly adjusting to keep things perfectly balanced.
Precisely. It's a beautifully orchestrated system. When you eat, your blood glucose levels rise. The beta cells detect this and release insulin, which acts like a key, unlocking your cells so glucose can enter and be used for energy. This lowers your blood sugar. Then, if your blood sugar dips too low, say between meals, the alpha cells release glucagon. Glucagon basically tells your liver, hey, release some of that stored glucose, bringing those levels back up. It's this constant dynamic push and pull.
And when that delicate constant adjustment goes awry, when that thermostat breaks, so to speak, that's where diabetes enters the picture. So at its core, how do we define this condition? What does it actually mean?
Right. At its simplest, diabetes isn't a single disease, but rather a group of metabolic disorders. The defining characteristic, the common thread, is hyperglycemia. That's just the technical term for elevated blood glucose levels. And this elevation happens for one of two core reasons, or sometimes both. Either your body isn't producing enough insulin, or your body's tissues aren't responding properly to the insulin it is producing. That's what we call insulin resistance. Or, like I said, it could be a combination.
Here's where it gets really interesting, because as you just hinted, not all diabetes is the same. There are distinct types, each with its own story. Let's start with type 1 diabetes. What makes it so distinct from the others?
Type 1 diabetes is unique because, well, unlike some other forms, it cannot be prevented. It's an autoimmune condition. Basically, the body's own immune system mistakenly attacks and destroys those crucial insulin-producing beta cells in the pancreas. This leads to an absolute insufficiency of insulin. The body simply can't make enough, or eventually any at all.
Right, so the production factory is essentially shut down by the body itself.
Exactly. And its onset is typically in childhood or young adulthood, which is why it used to be called juvenile diabetes, although we know now it can develop at any age. The cause isn't direct inheritance like eye color, but it involves a mixed genetic predisposition, maybe environmental triggers, immunological factors. We're still learning about the exact triggers. What often surprises people about type 1 is the sheer speed of its onset. Symptoms can manifest quite acutely, sometimes really quickly. Things like frequent urination, being incredibly thirsty, increased hunger but still losing weight suddenly, nausea, vomiting, fatigue. It can hit hard and fast.
Okay, that's a very clear picture of type 1. Now, type 2, which seems to be talked about more often and is increasingly prevalent, that has its own unique story and often a much more gradual onset, right?
That's exactly right. Type 2 diabetes typically develops later in life, usually after age 30, though sadly we are seeing it more frequently in younger people now, even kids. Its mechanism is a bit different. It's usually a combination. The pancreas might not be producing enough insulin to meet the body's needs, and critically, the body's cells become resistant to the insulin that is being produced. It's like the key is there, but the lock on the cell door is getting rusty or jammed. It doesn't open easily.
So the glucose can't get into the cells effectively, even with insulin around.
Precisely. And there are many contributing factors here. Family history definitely plays a significant role. Lifestyle factors are huge too. Things like obesity, high blood pressure, leading a sedentary life. We also see higher rates in certain ethnic populations like African American, Native American, and Hispanic communities. A history of gestational diabetes also increases risk. And here's something really interesting and maybe less talked about. Even prolonged psychological or emotional stress can play a role.
Stress. How does that factor in?
Well, when you're stressed, your body releases hormones like cortisol and epinephrine. These are designed for fight or flight. They raise your blood sugar to give you quick energy. But if you're under chronic stress, this happens constantly, placing an increased and continuous demand on the pancreas to produce more insulin. Over time, this can contribute to wearing out the beta cells or worsening insulin resistance. Also, some medications, like certain diuretics or long-term corticosteroid use, can sometimes contribute to developing type 2.
That makes sense. And the onset is different too, you said. More gradual.
Very gradual, yes. Unlike type 1's rapid onset, type 2 often develops slowly. People can be asymptomatic for years, sometimes without even knowing they have it. Common signs might include weight gain, which can sometimes be the body trying to compensate by making more insulin, initially fatigue, maybe some vision changes, wounds that heal slowly, or getting infections more often. Sometimes the classic polyuria, frequent urination, polydipsia, thirst, polyphagia, hunger can occur, but often they're milder or develop later than in type 1. It's often only when a complication arises, maybe problems with vision or kidney issues or even something like gangrene in the foot, that someone gets tested and finds out they have diabetes.
Wow, so you could have it for a while before realizing.
Absolutely. The good news, though, is that type 2 can often be managed, sometimes very effectively, with lifestyle changes. Significant improvements in diet, regular exercise, weight loss, these can make a huge difference. Oral medications are also common. However, insulin might become necessary down the line or temporarily during periods of high physical stress, like a bad illness, infection, or major surgery.
Okay. And you mentioned other types briefly.
Yes, just quickly, there's what's sometimes called secondary diabetes, or type 3, which isn't Alzheimer's-related type 3, but rather diabetes that develops because of another medical issue. Things like pregnancy, certain tumors, or maybe if someone has had their pancreas surgically removed. And then there's gestational diabetes, which specifically occurs during pregnancy. This needs careful management, usually a nutritious diet, watching carbohydrate intake, controlled weight gain, exercise like walking. Women with gestational diabetes often need to monitor their blood glucose at home, and sometimes insulin is required to keep both mother and baby healthy during the pregnancy.
Got it. You mentioned insulin resistance earlier, especially with type 2. It sounds like a key warning sign. This brings us to a related concept, metabolic syndrome. What's the connection there?
Yeah, that's a really important connection to make. Metabolic syndrome isn't technically diabetes itself, but you can think of it as a major precursor, a big red flag for developing type 2 diabetes and also heart disease and stroke. It's basically a cluster of conditions that often occur together. The core feature is insulin resistance. Because the cells aren't responding well to insulin, the pancreas has to pump out more and more just to try and keep blood glucose levels normal.
Working overtime, essentially.
Exactly. And this insulin resistance is usually accompanied by other issues: high blood pressure, unhealthy cholesterol levels, high triglycerides, low HDL, sometimes atherosclerosis starting, and often excess fat around the abdomen. The significance is clear. If your beta cells eventually get exhausted and can't keep up with that massive demand for insulin caused by the resistance, that's when type 2 diabetes fully develops. The blood sugar starts to rise uncontrollably. And those sustained high blood glucose levels themselves cause problems. They can lead to osmotic diuresis, basically. Your kidneys try to flush out the excess sugar, putting water with it, making you dehydrated. It can also trigger lipolysis, the breakdown of fat for energy, which sounds good but can produce ketones, leading to issues like ketonuria. Plus, high glucose contributes to inflammation, slows blood flow, accelerates artery hardening, and even makes skin and urine environments more welcoming to bacteria, leading to more infections. It's a whole cascade.
Okay, that paints a clear picture of the lead-up and effects. So with all these different types and underlying mechanisms, how do healthcare professionals actually nail down a diagnosis? What are they specifically looking for in tests?
There are a few standard ways, well-defined diagnostic criteria. One way is if someone has the classic symptoms of diabetes, like the excessive thirst, frequent urination, maybe unexplained weight loss, and a random or casual blood glucose test shows a level of 200 milligrams per deciliter, mgdl, or higher.
Okay, symptoms plus a high random reading.
Right. Another very common method is a fasting blood glucose test. This is done after you haven't eaten for at least 8 hours. A level of 126 milligdl or greater on this test points to diabetes. Then there's the oral glucose tolerance test, OGTT. For this, you fast, have a baseline blood draw, then drink a specific sugary drink, and your blood glucose is checked again after 2 hours. If that 2-hour level is 200 milligdl or greater, that's also diagnostic for diabetes. And finally, there's a really important test called the HbA1c, or glycosylated hemoglobin test.
Ah, yes, the A1C. You hear about that one a lot. Why is it considered so reliable? It seems different from just checking sugar right now.
That's a great question. It's reliable because it gives you a longer-term picture. See, glucose in your blood naturally sticks to hemoglobin, the protein in your red blood cells. Red blood cells live for about 120 days, or roughly 3 months. So the HbA1c measures the percentage of your hemoglobin that has glucose attached to it. This percentage reflects your average blood glucose levels over the past 8 to 12 weeks. It's not just a snapshot like a finger stick, it's more like an average trend line.
Like looking back over the last few months' performance.
Exactly. An HbA1c level of 6.5% or greater is diagnostic of diabetes. For someone already diagnosed, we often aim for an A1c below 7% to minimize complication risks. If someone's A1c is, say, 8%, that tells us their average blood sugar has been around 200 milligdl, even with treatment, and adjustments are definitely needed. It's a key tool for monitoring how well treatment is working over time.
Okay, that makes perfect sense. Now, this is where understanding the condition becomes incredibly critical, I think. The complications. What are the major issues, both the immediate dangers and the long-term problems, that can arise if diabetes isn't managed well? This is the section that really highlights the stakes, doesn't it?
It really does. The complications can be quite serious, and they range from acute, life-threatening emergencies to chronic, debilitating conditions affecting nearly every part of the body. Let's start with the acute complications. First, you have hyperglycemia itself, blood sugar that's too high. We talked about symptoms. Maybe a fruity smell on the breath from ketones, rapid deep breathing called Kussmaul's respirations as the body tries to fix acidosis, hot dry skin, flushing, extreme thirst, frequent urination, blurred vision. The immediate treatment involves insulin. On the flip side, and just as dangerous, is hypoglycemia blood sugar that's too low, usually defined as below 60 or 70 milligdl, depending on the guideline. This is crucial knowledge for anyone, whether you or someone you know might be affected.
Yeah, this seems like something everyone should know about.
Absolutely. Symptoms can hit fast. Shakiness, tremors, feeling weak or faint, confusion, sudden sweating, diaphoresis, irritability, heart palpitations, though beta blocker medication can mask this intense hunger, sometimes personality changes, or even loss of consciousness. Skin might feel cool and moist. The immediate response is key. Give fast-acting carbohydrates, juice, regular soda, not diet, glucose tablets, even just sugar. If the person is unable to swallow or unconscious, they might need an emergency glucagon injection, IM or subcutaneous, or IV dextrose like D50. Then always recheck the blood glucose in about 15 minutes to make sure it's come up.
Okay, fast sugar if conscious, emergency held if not. Got it.
Right. Then there are two more severe acute crises. First, hyperglycemic hyperosmolar state, or HHS. This is more common in type 2 diabetes. Blood glucose gets incredibly high, often over 600 milligdl. The main problem is extreme dehydration because the blood is so concentrated with sugar, pulling water out of tissues. It leads to low blood pressure, fast heart rate, altered mental status. It's often triggered by illness or infection. It's a true medical emergency needing fluids, insulin, and electrolyte correction. Second is diabetic ketoacidosis, or DKA. This is more typical in type 1 diabetes, but can happen in type 2 sometimes. It's caused by a severe lack of insulin. Blood glucose is high, maybe 250, 800 milligdl, but the body also starts breaking down fat rapidly for fuel because it can't use glucose. This produces ketones, which are acidic, so you get high blood sugar, dehydration, and metabolic acidosis. That's where the fruity breath and Kussmaul breathing come from. Abdominal pain, nausea, vomiting are also common. Like HHS, DKA is life-threatening and requires urgent hospital care. 5 fluids, insulin drip, careful electrolyte monitoring, especially potassium.
Wow, those sound incredibly serious. And those are the acute ones. What about the long-term chronic complications?
Yes, the chronic complications develop gradually over years, especially if blood glucose control isn't great. They are largely due to damage to blood vessels, both large and small, and nerves. First, diabetic retinopathy. This affects the eyes. High blood sugar damages the tiny blood vessels in the retina at the back of the eye. They can leak, bleed, or form fragile new vessels. This causes hemorrhages, vision changes, and can eventually lead to blindness. Laser therapy, photocoagulation, can help seal leaking vessels, but good blood sugar control is the best prevention.
So keeping blood sugar in check directly protects your eyesight.
Directly. Similarly, diabetic nephropathy affects the kidneys. It's a progressive decline in kidney function due to damage to the filtering units. Early signs include protein leaking into the urine, albuminuria. Over time, it can lead to fatigue, anemia, frequent UTIs, and eventually kidney failure, requiring dialysis or a kidney transplant. Managing blood pressure is also crucial here. Then there's diabetic neuropathy, which is nerve damage. This is very common. It often starts as paresthesias, tingling, numbness, burning, or pain, usually in the feet and legs first, stocking glove pattern. It can also decrease reflexes and sensation, meaning someone might not feel heat, cold, pain properly. This loss of sensation is a huge factor in foot disorders and complications. If you can't feel a small cut, blister, or pressure point on your foot, it can easily become infected or turn into a serious ulcer without you realizing it.
That highlights how critical daily self-care becomes, especially foot care.
Absolutely critical. Poor circulation, also common in diabetes, compounds the problem. Wounds heal slowly. That's why daily foot inspection, washing and drying carefully, especially between toes, wearing well-fitting shoes, never tight, clean socks, never going barefoot, and regular podiatrist visits are non-negotiable. Even cutting toenails needs care straight across, and may be best done by a professional if vision or sensation is poor. Avoiding heating pads on feet is also vital due to burn risk.
Makes sense. What other systems are affected long-term?
Major ones include the cardiovascular system. Diabetes significantly increases the risk of cardiovascular and cerebrovascular disease. This means a higher chance of hypertension, coronary artery disease leading to heart attacks, and cerebrovascular accidents, strokes. Atherosclerosis, or hardening of the arteries, happens faster and more severely. That's why managing cholesterol, keeping blood pressure under control, maintaining a healthy weight, and following a heart-healthy, low-fat diet are all incredibly important parts of diabetes management. We also see issues like sexual dysfunction, particularly erectile dysfunction in men, due to nerve and blood vessel damage. It's important for people to feel comfortable discussing these concerns with their doctor. And even periodontal disease or gum disease is more common and can be more severe in people with diabetes. It really underscores how diabetes is a systemic condition affecting the whole body.
Wow. That's a really comprehensive and frankly sobering overview of the potential consequences. It really drives home the importance of management. So this deep dive wouldn't be complete without looking at the how-to, how is diabetes actually managed in daily life. This is where proactive choices truly come into play, offering real empowerment, right?
Absolutely. Proactive management is the cornerstone, and dietary considerations are paramount. Now, there isn't one single diabetes diet that fits everyone. The best approach involves working with a registered dietitian. They can help create an individualized meal plan considering age, weight, activity level, cultural background, food preferences, everything. It's not just about avoiding sugar. It's about balancing macronutrients, typically around 50% carbohydrates, 30% fats, 20% proteins, though this can vary. It's about choosing healthy carbs, fats, and proteins and managing portion sizes.
So personalization is key.
Very key. Some follow structured plans like food exchanges or carb counting, especially if using insulin. Others might use a more qualitative approach, focusing on reducing simple sugars, unhealthy fats, and alcohol. For those on insulin, consistent meal timing and carbohydrate intake are crucial to match the insulin action and prevent lows. Often, planned snacks between meals are needed. The main goals are always to keep blood glucose levels within the target range as much as possible and to achieve and maintain a reasonable, healthy body weight. And what's really encouraging is that for many people with type 2, especially if overweight, significant changes in diet combined with regular exercise can sometimes lead to enough weight loss and improved insulin sensitivity that they might be able to reduce or even stop medications.
That's a powerful motivator. What about exercise specifically?
Exercise considerations are huge. Regular physical activity offers so many benefits for people with diabetes. It naturally helps lower blood glucose levels by making cells more sensitive to insulin and using glucose for energy. It reduces cardiovascular risks, improves blood circulation, helps with weight management, improves muscle tone, lowers cholesterol and triglycerides. The list goes on. Plus, it just promotes overall well-being.
What do people on insulin need to keep in mind with exercise?
That's an important point. Because exercise lowers blood sugar, someone taking insulin needs to be careful to avoid hypoglycemia during or after activity. Initially, they might be advised to check their blood sugar before exercising and eat a small carbohydrate snack, maybe 15 grams, like a piece of fruit beforehand, especially if the exercise is moderate or long. They might also need to adjust insulin doses around exercise, which is something they'd work out with their healthcare team.
Okay, so planning is needed there too. Now, you mentioned stress earlier. How does dealing with being sick or injured or having surgery affect diabetes management?
That's another critical area. The stress of acute illness, injury, or surgery significantly impacts blood glucose. What's fascinating, and maybe counterintuitive, is that when your body is under physical stress fighting an infection, healing from injury or surgery, it releases stress hormones.
Like the cortisol and epinephrine you mentioned before.
Exactly. And those hormones raise blood glucose levels. So even if someone is sick and not eating much, their blood sugar can go up, sometimes quite high. This means that during illness, injury, or surgery, a person with diabetes often needs more insulin, not less. Blood sugar should be checked much more frequently, maybe even every hour or few hours depending on the situation. If there's a fever, checking urine for ketones is important too, especially for type 1. Staying hydrated is crucial, so increasing fluid intake is necessary. And even if appetite is poor, trying to get in some calories, especially carbohydrates, is important to provide energy for healing and prevent the body from breaking down too much fat, which could lead to DKA in type 1.
So being sick actually increases the need for management and potentially insulin.
Definitely. If blood glucose levels are consistently high, say above 250 milli-GDL, it's important to contact the doctor, as treatment adjustments will likely be needed. For planned surgery, there's usually a specific protocol. The person might need insulin adjustments before, during, and after the operation, especially if they have to be NPO, nothing by mouth. Even type 2 patients who normally manage with a diet or oral meds might need temporary insulin during the surgical period to maintain good glucose control, which is important for healing. It really shows how the body's stress response deeply interacts with glucose regulation.
What a journey we've been on from the tiny, mighty pancreas, exploring its intricate functions, understanding the different types of diabetes, the serious potential complications, and finally, digging into the comprehensive daily management strategies. It really gives you a profound appreciation for how our internal systems work and how they sometimes need really careful, informed tending.
Absolutely, and knowledge is most valuable when it's understood and applied, isn't it? This deep dive, I hope, has illuminated the profound interconnections